For number 86, a gram-negative bacillus was isolated from a wound infection caused by a bite from a pet cat. Again, cat bite. The following characteristic reactions were seen. Oxidase positive, McConkey, no growth. Motility negative, catalase positive. Glucose OF is fermentative. Question: which of the following is the most likely organism? Is it letter A, Pseudomonas aeruginosa, letter B, Aeromonas, letter C, Pasteurella, or letter D, Vibrio cholerae? Okay, so bite from a pet cat. Correct answer is letter C. Again, for number 86 po, correct answer is letter C, Pasteurella multocida. Now, Pasteurella multocida po is part of the normal mouth flora of cats and dogs, and it is frequently recovered from wounds inflicted by them. Now, it produces large amounts of indole also, and therefore an odor resembling an E. coli. So, Pseudomonas species po, they are also catalase positive. Again, Pseudomonas species are also catalase and oxidase positive po. But they can be ruled out because they grow on McConkey. Take note, si Pasteurella multocida cannot grow on McConkey agar po. Okay, for number 86, we have letter C. Okay, so common question in the ASCP exam, how do we differentiate between Burkholderia cepacia and Stenotrophomonas maltophilia, both of which cause cystic fibrosis, aside from Pseudomonas aeruginosa. Now, B. cepacia, remember, the color of the pigment on the blood agar plate is green to yellow, or yellow with a green tinge. For S. maltophilia po, that's lavender green pigment on back. Also, sa oxidase test, they differ because B. cepacia po is oxidase positive, S. maltophilia po is oxidase negative. And B. cepacia po is DNase negative, S. maltophilia po is DNase positive. For number 87, characteristics necessary for the definitive identification of Mycobacterium tuberculosis are buff color, slow growth at 37 degrees Celsius, niacin production positive, nitrate reduction negative. Letter B, rough colony, slow growth at 37 degrees Celsius, non-pigmented. Letter C, rough, non-pigmented colony, hoarding positive, niacin production negative, catalase negative. And is it letter D, rough, non-pigmented colony, slow growth at 37 degrees Celsius, niacin production and positive nitrate, niacin production positive and nitrate reduction positive. Of course, correct answer po is letter D. Again, Mycobacterium tuberculosis colonies are rough, non-pigmented. They're with slow growth at 37 degrees Celsius po, niacin production positive, nitrate reduction positive. Now, how do we differentiate between the mycobacteria? Okay, for niacin, only M. tuberculosis is niacin positive, or niacin production positive. For nitrate reduction, M. TB, M. kansasai, and M. fortuitum are nitrate reduction positive. All others are negative. Now, for aryl sulfatase, the only positive for aryl sulfatase test is M. fortuitum. And for twin hydrolysis, remember, twin hydrolysis positive, we have M. kansasai and M. gordoni. So those are the NTM or non-tuberculoid mycobacteria based on Runyon's classification. So this is on the basis of pigment and rate of growth. So they can be categorized into photochromogens, scotochromogens, non-chromogens, or rapid growers po. So photochromogens, for example, we have M. kansasai, M. marinum po. Now, photochromogens, their colonies develop pigment following exposure to light, and also growth on more than 7 days on solid media. Now, for scotochromogens, that includes M. scrofulaceum and M. gordoni. Now, their colonies develop pigment in the dark or light, and their growth, okay, is in more than 7 days on solid medium. For non-chromogens, example, we have M. avium intracellular and M. cenope. Their colonies are non-pigmented, irrespective of exposure to dark or light, and their growth, okay, is more than growth in more than 7 days on solid medium. And for rapid growers, that includes M. chelonae and M. fortuitum po. Colonies appear in less than 7 days on solid medium. Okay, for number 88, when grown in the dark, yellow to orange pigmentation of the colonies is usually demonstrated by, again, dark yellow to orange pigmentation, MTB, M. kansasai, M. fortuitum, or M. scrofulaceum. Take note, dark yellow yellow to orange pigmentation po. Correct answer is letter D, Mycobacterium scrofulatium, which is a scotochromogen. Now M, tuberculosis does not produce pigmentation in the dark or after exposure to light. Okay, so we say na photochromogen. Tama? A common tap water scotochromogen po, we have M. gordoni. Now, the pathogenic scotochromogens naman, these include M. sulgi, we have M. scrofulatium, and M. cenope po. M. kansasai, on the other hand, that is a photochromogen producing a yellow pigment. Following exposure to light, also yung M. kansasai po can produce red beta-carotene crystals after long incubation periods. Now, also take note, both pathogenic and saprophytic mycobacteria may produce urease, and urease production po is used to differentiate several mycobacteria species po. Si M. scrofulatium po, almost parehas po sila ni M. gordoni. Again, almost biochemically identical po sila ni M. gordoni, except sa urease reaction. Bakit po? Because M. scrofulatium po is urease positive. Again, M. scrofulatium is urease positive, M. gordoni is urease negative. Now, for number 89, a jaundiced 7-year-old boy with a history of playing in a pond in a rat-infested area has a urine specimen submitted for a direct dark field examination. So, no organisms are seen in the specimen, which medium should be inoculated in an attempt to isolate the suspected organism. And keyword po natin, rat-infested area, direct dark field examination. Tama? So, this will give us a clue that spirochetes. Tama? Yung hinahanap natin. Now, ang question, anong medium? Okay? Is it letter A, blood cysteine dextrose, letter B, PPLO agar, letter C, Fletcher semi-solid, or letter D, chopped meat glucose po? Again, for spirochetes, tama, we have the Fletcher semi-solid medium po. For number 89, letter C. Next, okay, no rhizoids. Is it Absidia? Is it Mucor? Is it Rhizopus, or all of these? Again, no rhizoids. We have letter B, Mucor po. Again, no rhizoids, Mucor. Next, okay, the term internal autoinfection is generally used in referring to infections with what? Again, internal autoinfection. Is it letter A, Ascaris lumbricoides, letter B, Necator americanus, letter C, Trichuris trichura, or letter D, Strongyloides stercoralis? Again, internal autoinfection po, we have Strongyloides stercoralis po. Number 91, letter D. Next, okay, given the following plate, identify, this is the gravid segment of what? Right? Visualization of India ink into the lateral genital pore. Okay, 15 to 30 branches po. Okay, that's Tinea saginata. 7 to 13 branches naman po for Tinea solium. Ano kaya to? Tinea saginata or Tinea solium? Okay, correct answer is letter B. Tinea solium po yan. Again, gravid segment of Tinea solium. Gravid segment naman to ng ano. Okay, given the following plate, again, visualization of India ink into the lateral genital pore, 15 to 30 branches po. Tinea saginata or Tinea solium, of course, that's Tinea saginata po. Number 93, letter A po. Next, okay, let's go to Plasmodium. Which species of malaria parasite usually has amoeboid trophozoites? Pa-highlight naman po ng amoeboid trophozoites and produces small reddish dots in the red blood cell cytoplasm. Is it Plasmodium knowlesi, Plasmodium falciparum, Plasmodium malariae, or Plasmodium vivax? Again, amoeboid trophozoites po. We have letter D, Plasmodium vivax. So, going to the life cycle of Plasmodium species. So, of course, alam po natin that malaria is caused by blood parasites of the genus Plasmodium. Now, there are approximately 100 named species of Plasmodium which infect various species of vertebrates. Now, 4 species po are considered the true parasites of humans po. And they utilize humans almost exclusively as a natural intermediate host. So, we have P. falciparum, P. vivax, P. ovale, and P. malariae po. However, there are also mayroon ding periodic reports po ng simian malaria parasites being found in humans. And most reports implicating P. knowlesi. At the time of this, or at this moment, it has not been determined if Pinot-Leslie po is being naturally transmitted from human to human via the mosquito without the natural intermediate host, which is monkeys, diba? Macaque monkeys. Therefore, Pinot-Leslie is still considered po a zoonotic malaria. Now, the malaria parasite life cycle involves two hosts. Okay? Again, it involves two hosts. During a blood meal, a malaria-infected female Anopheles mosquito inoculates sporozoites into the human host. Now, these sporozoites infect liver cells. And they mature into schizons, which rupture and release, in turn, they release merozoites. So note that in P. vivax po and P. ovale, a dormant stage, we call that as hypnozoites, can persist in the liver. And this may cause relapses po by invading the bloodstream weeks or pwede ding years later po. Now, after this initial replication in the liver, okay, so we have exoerythrocytic schizogony. The parasites undergo asexual multiplication in the erythrocytes. Okay, so yan po. We call that as erythrocytic schizogony naman po. So merozoites infect red blood cells. Yan po. And then the ring stage trophozoites mature into schizons, which rupture releasing merozoites. Now, some parasites differentiate into sexual erythrocytic stages. Okay, or we call them as gametocytes. Okay, now blood stage parasites po are responsible for the clinical manifestation of the disease. Now, the gametocytes, male microgametocytes and female macrogametocytes are ingested by the Anopheles mosquito during a blood meal. So, the parasite's multiplication in the mosquito po is known as the sporogonic cycle. While in the mosquito stomach, the microgametes penetrate the macrogametes, generating zygotes. And these zygotes, in turn, they become motile and elongated oocytes. And these oocytes invade the midgut wall of the mosquito, where they develop into oocysts. Now, the oocysts rupture and they release sporozoites po, which may make their way to the mosquito's salivary glands. So, yung inoculation po ng sporozoites into a new human host perpetuates the malaria life cycle. Again, we have P. falciparum causes malignant tertian malaria. In here, okay, RBCs are normal in size, tama? Okay, pigments with the Morris dots and Christopher's dots, stages in peripheral blood, ring forms, and gametocytes. And the asexual cycle paroxysm is at 48 hours po. Siya po yung may banana or sickle or sausage-shaped gametocytes. Next, for P. vivax. Call it as benign causes benign tertian malaria. So, RBCs are characterized as enlarged or pale, okay, with characteristic Schaffner's dots. And all stages occur in the peripheral blood. And paroxysm is at 48 hours po. For P. ovale, causes of course ovale malaria, RBCs are characterized as enlarged, often with torn, jagged end, or fringes or irregular edges po. Characteristic Schaffner's dots and James dots po for P. ovale po. And remember, all stages po may occur in the peripheral blood. And paroxysms po is at 48 hours. Of course, we have P. malariae or quartan malaria po. So, P. malariae causes quartan malaria with characteristic Zimmermann's or Zimmermann's dots po. Also take note, remember po, again, for all Plasmodium species, P. ovale, P. malariae, and P. vivax, okay, all stages can be found in the peripheral blood. Except, of course, for P. falciparum, because the stages present in the peripheral blood are the ring forms and the banana-shaped gametocytes. Okay, so we have the Plasmodium knowlesi. Okay, fifth human parasite. This is normally a parasite of long-tailed macaques, Macaca fascicularis. Again, Yung Plasmodium with amoeboid trophozoites, that's Plasmodium vivax. Plasmodium malariae, that's Plasmodium with band trophozoites. And we have the malaria rapid diagnostic test. We have the HRP2 or histidine-rich protein 2. This is a water-soluble protein produced by trophozoites and young gametocytes of P. falciparum. We have the PLDH or Plasmodium lactate dehydrogenase. This is produced by both sexual and asexual stages po. It can distinguish between P. falciparum and non-P. falciparum. And we have P. aldolase. This is an enzyme in the glycolytic pathway pressed by the blood stages of all Plasmodium species po. Next, a patient's urinalysis revealed a positive bilirubin and a decreased urobilinogen level. These results are associated with letter A, hemolytic disease, letter B, biliary obstruction, letter C, hepatic disease, or letter D, urinary tract infection. Pa-highlight po ng positive bilirubin and decreased urobilinogen level sa urine. Okay, correct answer is letter B, biliary obstruction. So take note, again, sa pre-hepatic phase, hemolytic disease, increase po yung indirect bilirubin sa blood, but negative po ang urine bilirubin and positive urine urobilinogen. For the hepatic phase, as seen in liver damage, increase po yung indirect bilirubin and direct bilirubin sa blood. Negative po yung urine bilirubin and positive, negative or positive by the way, ang urine bilirubin and positive po ang urine urobilinogen. And we have the bile duct obstruction po, okay, post-hepatic or obstructive phase. So increase po yung direct bilirubin sa blood, positive ang urine bilirubin at negative naman or decrease ang urine urobilinogen po. Next, oval fat bodies are A. Squamous epithelial cells that contain lipids. Letter B. RTE cells that contain lipids. Letter C. Free-floating fat droplets. Letter D. White blood cells with phagocytized lipid. Okay, so anong answer natin dito? For number 98, of course, oval fat bodies are RTE cells that contain lipids. Next, okay, the final phase of degeneration that granular casts undergo is represented by which of the following casts? Fine, porous, cellular, or waxy? Again, final phase po, we have the waxy cast. Next, the presence of renal tubular epithelial cells and cast is an indication of what? Again, pilot po ng RTE cells. Is it acute interstitial nephritis, chronic glomerulonephritis, minimal change disease, or acute tubular necrosis? Correct answer po is letter D, acute tubular necrosis. 98, letter D. For number 99, a 35-year-old patient being treated for a sinus infection with methicillin develops fever, a skin rash, and edema. Now, urinalysis results are as follows. Kung mapapansin nyo po, okay, color is dark yellow, clarity, cloudy. So, what else? Leukocyte 2+, okay, with presence of RBCs and WBCs. But, after receiving the urinalysis report, the physician orders a test for urinary eosinophils. And it was found out that the urinary eosinophil result is 10%. Remember, 1% lang ay significant. So, 10% sa kanya, okay, that is indicative. Is it acute glomerulonephritis, acute interstitial nephritis, acute pyelonephritis, or acute tubular necrosis? Okay, correct answer po is letter B. Again, eosinophils for acute interstitial nephritis. Next, which of the following is an abnormal crystal described as a hexagonal plate? Okay, we have letter A, cystine po. Again, following is an abnormal crystal described as a hexagonal plate. So, those are the elements po na may kaparehas. Okay, yung may resemble each other. RBCs, yung pinakamahirap na identify sa clinical microscopy. Why? Because it may resemble many elements. For example, cells, oil, and fat droplets, air droplets po. And we have radiographic contrast media po. Resembles cholesterol, uric acid, calcium carbonate po. Cystine resembles uric acid. Hippuric acid resembles calcium oxalate, monohydrate crystals po. P. vaginalis resembles WBC, transitional and RTE cells. Starch granules resembles fat droplets and RBCs po. Next, normal CSF. Again, normal CSF has a relative abundance of which of the following proteins when compared to serum? Is it transferrin? Is it prealbumin? Is it albumin? Or fibrinogen? Okay, of course, correct answer is letter B, prealbumin po. Remember, normally present in the CSF po, we have albumin, which is the predominant. Second po, most prevalent is prealbumin or transthyretin. Followed by the beta globulins, we have the carbohydrate deficient tau transferrin, and gamma globulins po. Primarily IgG po, but some IgA. Take note po, sa CSF, IgM is not present, fibrinogen is not present, and so is beta-lipoprotein. So yan, the following criteria used to distinguish punta tayo between pathologic bleeding and traumatic tap. Of course, a serial decrease po in RBCs in tubes 1 to 3 is seen with traumatic tap. That means po hindi po uniforming distribution ng blood sa each tubes. Now, a clotted specimen po or clumped RBCs that indicates traumatic tap. And also, we base sa supernatant. If yung color po ng supernatant is clear, okay, or if yung form is clear po, that's indicative of traumatic tap. Pero pag may color, pink, yellow, brown, supernatant, okay, xanthochromia, tama po ba? That indicates pathologic bleeding po. And a ratio of greater than 500 RBCs for every WBC, remember, indicates traumatic tap. Yan po. Again, positive clot formation for traumatic tap, negative for intracranial hemorrhage. Supernatant fluid po, clear for traumatic tap. Xanthochromic naman po for intracranial hemorrhage po. Okay, for 102, a clear colorless CSF was obtained by lumbar puncture from a 2-year-old child who is lethargic and has fever. A cell count on an undiluted specimen revealed 860 WBCs and 60 RBCs in 9 square millimeters of the hemocytometer po. So, anong correct dyan? Yung count. Okay, correct answer po is letter C, both of these. Both WBCs 956 per mm cube and RBC 67 per mm cube. So remember, undiluted CSF, okay, for undiluted CSF, the dilution factor po is 1 po. So cells times dilution factor divided by all over F squared times 0.1 depth. Number 103, refer to panel 1. Again, for 103, refer to panel 1. Which you have in your paper, which antibody is most likely implicated. So given the following antigram, I think you have a copy of that. Is it letter A, anti-Duffy B, letter B, anti-Kid B, letter C, anti-E, or letter D, anti-C, and anti-K? For number 103, the answer is letter B, anti-Kid. Why is that? Again, why is that? Now, why is that? Again, why is that? Bakit anti-Kid B yung answer? So, one technique that we can use is to refer from the test 37 degrees Celsius and the IAT. Kung makikita nyo, again, we have the 37 degrees and yung IAT sa pinaka-right. Okay? So, pipiliin nyo dyan yung may negative na reaction. Okay? Negative na reaction, 37 degrees and IAT. So, anong cell yun? Anong panel cell? That's cell 5, right? And cell 7. Okay, so since yung 37 degrees and yung IAT ay negative reaction, so pipiliin nyo dyan yung may negative reaction din. So, lahat ng may positive is i-cross out na natin. For panel 5, cross out na yan. So, yan na lang naiwan. Yung manatira. Now, for panel 7 naman, okay, again, like ginawa ko sa panel 5, i-cross out din po natin yung mga may positive reaction po. Okay, so that leaves us with that. So, kailangan nating i-cross out yung mga di kasamang blood group. Okay, based sa pag-cross out ng positive reactions. So, hindi na po yan kasama. Yung naiwan na lang is, yan, we have C, okay, we have Kid, we have Lewis A, and Lutheran po. So, sa choices po, yung given lang po is Kid B. So, yung answer po natin is Kid B. How about sa 104? Refer to panel 2, which antibody specificity is most likely present. Again, which antibody specificity is most likely present? Given from yung copy ninyo, is it anti-S and anti-E, anti-E and anti-K, anti-Lewis A and anti-Duffy B, or anti-C and anti-K? Again, which antibody specificity is most likely for panel 2 naman? Okay, correct answer po for number 104, letter D po, anti-capital C and anti-capital K. Why is that? Now, bakit yun naman yung answer? Again, bakit yun naman yung answer for the panel 2? So again, we will base sa test sa 37 degrees Celsius and sa IAT. Okay, take note yung may negative reaction. Okay, yung anong cell yung may negative reaction, yung 37 degrees and yung IAT. Right, so we have panel cell 3, we have cell 6, cell 8, and cell 10. Now again, i-cross out na natin yung may mga positive reactions. So for panel 3 or cell 3, okay, cross out na po natin yan. And for panel 6, sino pa yung may positive reaction? Cancel out. And sino naman yung sa cell 8? Okay, cancel out din po. And for cell 10, cancel out. So tatanggalin na po natin yung mga blood group na hindi kasama. Okay, so that leaves us only with capital C, capital K, we have NOPS, okay, we have Lutheran A. So yung nasa choices po, yung tama is anti-capital C and anti-capital K. Again, anti-capital C and anti-capital K. For 105, on panel 2, which cells are homozygous for capital C? Again, on panel 2, which cells are homozygous for capital C? Is it letter A, 1, 2, 3, letter B, 1, 2, 9, letter C, 3, 4, 7, or letter D, 7, 8, 10? Ang answer po is letter B, 1, 2, 9. Bakit? Bakit po? Okay, kung mapapansin po ninyo, okay, capital C po, homozygous po in double dose. Again, so kung positive reaction po sa capital C, dapat negative po sa small c po. Now, in what cell yun? So, we have 1, 2, tama, and we have 9 po. Hindi po kasama si 4. Bakit? Kasi positive po sa C, capital C, and positive naman po for small c po. Again, double dose po. Homozygous in double dose. So, dapat pag sa capital C, positive, sa small c po, negative po. So, that's true for cells 1, 2, and 9. Next again, which of the following is most helpful to confirm a weak ABO subgroup? Of course, alam na natin yan. The answer is adsorption and elution. So again, adsorption and elution techniques po, these are used to detect ABO antigens that are not detectable by direct agglutination po. And the cells are incubated with the antibody to the antigen expected on the red blood cells po. So, ginagamit na po yung method na to when the LU weight po is tested for recovering anti-A. Next, a patient is readmitted to the hospital with a hemoglobin level of 7, 3 weeks after receiving 2 units of red cells. The initial serological tests are, again, okay, tinanong na po to. Okay, answer po is letter C, perform an elution and identify the antibody and the LU weight. Again, that 1 plus mixed field po. Again, may positive reaction po sa that. So, we will perform an elution po. Next, serological results on an untransfused patient where antibody screen po is negative at AHG, but sa DAT, 3 plus po with anti-C3d. LU weight is negative. So sa tingin nyo, anong condition to? So letter A, warm autoimmune hemolytic anemia. Letter B, cold agglutinin syndrome. Letter C, paroxysmal cold hemoglobinuria. Or letter D, drug-induced hemolytic anemia. Take note, positive po sa DAT with anti-C3d po. That means complement po. Okay, complement. Correct answer po is letter B, cold agglutinin syndrome po. For 108, letter B po. Next, based on the following phenotypes, which pair of cells would make the best screening cells? Basta take note po, hindi ito minememorize. Based on the following phenotypes, yung pair of cells that would make the best screening cells po. Hello? So, given po yung choices, correct answer po is letter D. Take note po, letter D po yung answer. So again, an antibody identification panel po is a collection of 11 to 20 group ORBCs po with various antigen expression po. Now, this pattern of antigen expression should be diverse so that it will be possible to distinguish one antibody from another po, and it should include cells with homozygous expression po. When you say homozygous expression po, okay, kasama po dyan yung, of course, yung RH, Duffy, KID, and MNS po. Okay? So, group O cells are used so that anti-A and anti-B will not interfere with the detection of antibodies po. So, yung minimin po ng homozygous expression dito, dapat po within the set, there should be one cell that is positive and the other, each of the following antigens po. Next, RULU does not interfere with ABO grouping, saline technique. Again, RULU does not interfere with ABO grouping, saline technique, room temperature phase, or AHG phase. Again, letter D po, AHG. Again, AHG phase po yung answer. Okay, so those are the sources of error in anti-human globulin testing po. So, false positive results, for usually mga interferences po. Also over centrifugation. For false negative, again, AHG is AHG reagent non-reactive po that may be due to deterioration or neutralization po. Okay, and also inadequate incubation conditions in the IAT po. Next, septic shock. Is it gram-positive, gram-negative, fungi, or viruses? Septic shock, okay, is associated with gram-negative bacteria po. For 111, letter B. For 112, a vancomycin-resistant gram-positive Coccobacillus resembling the Streptococcus viridans group was isolated from the blood of a 42-year-old female patient undergoing a bone marrow transplant. Now, the PYR and lab tests po were negative, and the following results were noted. Okay, so catalase po is negative, CAMP is negative, and then we have escalene hydrolysis negative, gas from glucose positive, and hipurate hydrolysis negative. 6.5% salt broth negative. Question po. What is the correct identification? Is it Leuconostoc, Enterococcus, Staphylococcus, and Micrococcus? Correct answer po is letter A, Leuconostoc. So remember, Leuconostoc po and Pediococcus, they are vancomycin. Pa-highlight po ng vancomycin resistant. Again, vancomycin resistant, catalase negative, gram-positive aerobic organisms po, recovered from immunosuppressed patients. Okay, they follow invasive procedures po, and they are also often recovered from positive neonatal blood cultures resulting from colonization during delivery. Next, pink colonies on Macunkie agar, citrate positive, lysine decar negative, ornithine decarboxylase positive, and arginine dehydrolase positive. Pa-highlight naman po ng ornithine decar and arginine dehydrolase positive, OA. Okay, tama, sino yung may OA dyan? Okay, we have Enterobacter cloacae po. Again, Enterobacter cloacae. So just a recap, tama, E. aerogenes po is positive for lysine decarboxylase and ornithine decarboxylase po. E. cloacae po is positive po for ornithine decarboxylase and positive also for arginine dehydrolase po. Okay? So, yan po. Okay, K-oxytoca po is indole positive naman. Next, reptiles kept as pets are sometimes associated with the transmission of, again, okay, Salmonella or Vibrio. Correct answer is Salmonella po. For 114, letter C, Salmonella. And for 115, spurious increase in the WBC count. Again, spurious increase in the WBC count. Is it letter A, clotting, letter B, smudge cells, letter C, uremia, or letter D, platelet clumping? Okay, correct answer po is letter D, platelet clumping po. So, yan po. Okay, cause of spurious increase po sa WBC. We have cryoglobulin, cryofibrinogen, heparin, monoclonal proteins, okay, nucleated red cells, and platelet clumping po. Again, platelet clumping po causes spurious increase in WBC. And those that cause spurious decrease naman po in WBC, in the automated cell counters, we have clotting, smudge cells, uremia, plus immunosuppressants po.